My name is Natasha Frost, and I'm with the Public Health Law Center. Today we're going to be going over information relating to these three key objectives. So we're going to start with understanding how an equity lens can positively impact low-income communities, communities of color, and the rural-urban dichotomy in Kansas. We're also going to be looking at how drafting effective policy skills and tools can be used in your communities to develop written documents. And finally, we're going to be identifying policy options available to impact healthy food, active transportation, and tobacco control using state laws impacting local efforts. And so I will be going over a series of tools that the Public Health Law Center has developed for Kansas communities. So to start, for those of you who don't know the Public Health Law Center, we are located at Mitchell-Hamlin School of Law in St. Paul, Minnesota. We do a lot of different things, but ultimately we really help kids like Drew eat strawberries and kale, and we do this through what's called legal technical assistance. Legal technical assistance has four main components. We start with looking into the legal research that's needed to help you in your policy efforts. For example, in Kansas, we've done a lot of legal research on local laws that impact the food system and the food environment. We have looked into specifically how to pass, for example, an ordinance to create a local farm and food task force to positively encourage healthy food and local food purchasing in your community. We've also done a lot of policy development in Kansas, and I'm going to talk through some of those examples. For example, we've worked with communities on developing traffic control measures for the school setting to promote biking and walking by students. And then finally, we have publications and trainings. So I will be highlighting our publications for Kansas, and the trainings, like the one today, we often have recorded and on our website for your viewing pleasure, or for your listening pleasure. We don't provide any direct representation, so I'm not becoming your attorney today, and we also don't lobby on behalf of a specific law or policy with a policymaker. Now, some of you may be wondering what the role of the Public Health Law Center is in Kansas. We've actually been participating and working with local communities and state-level communities in Kansas since 2013. We received a generous grant from the Kansas Health Foundation to work with their Healthy Communities Initiative in 2013. We started our effort by listening to communities and identifying the needs of those communities. What did they need? How could we help? And through the course of the last almost 4 years now, we've been able to respond to questions and develop a series of resources, and have spent the last 2 years really translating those resources that we've developed to identify ways to further help communities at the local level, build capacity at the local level, and expand our opportunities to work throughout Kansas. So now that the Kansas Health Foundation grant that began in 2013 has expanded into not only working with the Healthy Communities Initiative through the Kansas Health Foundation, but also we are now providing legal technical assistance to Pathways to a Healthy Kansas, which is a new grant program through Blue Cross Blue Shield of Kansas. We also are working with the Kansas Department of Health and Environment, which is actually the generous funder of today's presentation. And we are working with Casey Healthy Kids and working on some state-level work with Casey Healthy Kids. So I will be providing you with this link several times today, because one of the things we found is that regardless of how many times you've heard me or Mary present, questions arise. And so here is the information on how to contact both me and Mary. Mary is my colleague at the Public Health Law Center and does a lot of work in Kansas. I will tell you, Mary and I spend about every other month in Kansas, and lately I've been there about every month. So we know Kansas well, not as well as you might know working within your communities, but we certainly have gotten really to get to know the local communities and try and figure out what needs we needed to meet with our technical assistance. And we have developed a state-specific page for Kansas, which is featured here. It's just publichealthlawcenter.org/Kansas. And this is going to be the resources that I'll kind of end today's webinar with. So I just want to start to make sure we're all on the same page of what I'm talking about when I talk about public health and policy change. So first of all, public health is what we do as a society to collectively assure that conditions for people are healthy. And so this is done through a variety of factors, and as we all know, public laws and policies are actually what we can use to solve the biggest public health challenges. And the reason for that is because policy change, or PSE, policy systems and environmental change, we acknowledge that major health problems are not solved solely by individual actions. And so the example that I like to give is that when you come up, there's an example about a person coming to the side of a river and they see somebody in the river drowning, and so they walk out, they grab that person and they pull them to safety. And then they go back to the shore and they see yet another person drowning. And so you look around and you identify, okay, so you can pull people out individually and help save them and bring them to safety, or you can go and find out why are people falling into the river in the first place. And so the public health approach is actually going upstream and determining, oh, people are falling into the river because there's a hole in the bridge. And so what you do is you fix the hole in the bridge. And so rather than having an individual person-by-person approach, you're trying to fix the larger system that's causing the danger for those people when they fall into the river. And so that's that upstream approach, and we do this through policy change. And when I talk about policy, people really freak out with that word. Policy really just means that you have a written plan or course of action that's designed to influence and determine decisions. This can mean anything from a state-level policy change, which I will go over some of those that happened this year in Kansas, all the way through an organizational policy that helps guide day-to-day actions. For example, an organization that creates a healthy food policy that guides the purchasing decisions for the meetings of that organization. Those are all policies because they're a written plan or course of action designed to influence people's decisions. So many of you are familiar with this graphic, and what it is it really talks and frames that policy systems and environmental change context. We have individual behavior and we have programs. And when we started our work in Kansas, we really tried to find that the middle of that concentric circle, that overlap of those three concepts: policy systems and environmental change, individual practice and behavior, and then programs. But what we found through the evolution of our work in Kansas is that really our policies and environmental and systems changes, the systems really impact everything that we do. And the example is, and they really are impactful and supportive of our individual behavior and the programs that we work on. And you can't have really strong implementable policy systems and environmental change without strong programs and individual behavior change to affect change in that area. And the example would be, for example, when you're working at the school for a Safe Routes to School program, you can go ahead and get a really robust traffic control policy or a policy that changes biking and walking, but really utilizing education and curriculum to really promote that behavior change with the students, and also having programs such as a walking school bus program to really implement the changes that occurred at the policy level. So thinking about it holistically is really important, and that's why there's been an evolution of how we think about our policy systems and environmental changes in Kansas. Now, when we're thinking about what to do in a particular public health strategy, for example, trying to promote a healthy beverage, we really are, as I said, trying to get things in writing to have it translate into that policy change. And one of the reasons that is because people think about healthy beverages very differently. For example, you might have one person who believes that when you're talking about a healthy beverage, it could be any beverage without added sugars, including diet soda. Or another person might think that fruit juice, water, and milk is the only healthy option under that healthy beverage policy, or healthy beverage word. Or it could be that sports drinks are healthy, they can help rehydration. So you can see here that these three people might have three very different concepts of what is a healthy beverage. Now compare that to a written guideline or a beverage standard such as the one used by the National Alliance for Nutrition and Activity. That's very clear on what a healthy beverage is. So if you're operating from the same playbook of others in your community or others in your organization, it's really an opportunity to really infuse and have that healthy beverage permeate not just that policy change, but also influencing programs and that individual behavior model. So we talk a lot about programs, and there is this distinction between policy change and a program. So programs are often one-time events that focus on individual behavior. Programs are often not written down, and they're not really enforceable to the general community. A walking school bus is a really good example of a one-time event that's focused on individual behavior. Compare that to a traffic control law that would be passed, or policy that would be passed by a school district, or a written guidebook for how to manage a biking and walking to school. Those are very different. Those are policies. But a program like a walking school bus program would fit into all these categories. And the reason that we really focus on promoting we focus on policy changes because you can get that bigger community impact. So that line that goes all the way around our community versus that smaller circle or square there that impacts just the folks that are participating in a program. Another very common programmatic versus policy distinction is, for example, to promote biking and walking, there might be a 5K event, and so that's only going to impact those folks who might see or participate in that 5K event. Whereas a sidewalk policy that allows an interconnectivity for trails policy that's written down in the design standards or in a master plan impacts the entire community. So when you're trying to conceptualize and understand policy systems and environmental change, you really need to figure out and envision how those policy components influence that programmatic work. You also have to identify policy's power for that long-term impact, for that long-term change. And one of the things that I think one of the hardest things to do, and this goes back to those leadership principles from the campus leadership center's perspective, is that being uncomfortable with uncertainty and really understanding that when there's that, and being comfortable with that uncertainty. So knowing that change is happening when we're uncomfortable, and trying to get comfortable with not knowing exactly where the path is going to take us. So utilizing that experimental model. And then finally, really understanding, recognizing, and being aware of potential unintended consequences and applications that policy might have through that equity framework. And many people are struggling across the country on the concept of equity. And so many of you are working on food systems work, and so when you're talking about equitable engagement, we often think of like having a diverse group of stakeholders around the table. And when we think of a diverse group of stakeholders, when it comes to food system stakeholders, a lot of times we think about that circle that is the outer circle. People like having farmers at the table, having food distributors, thinking about health professionals at the table. But what's a little harder to wrap our heads around, and this varies from community to community, is that inner circle of folks, having them and having a diverse group of stakeholders that represent that inner circle. So having populations represented based on the different races that are representative of their community and culture, people with individuals with disabilities, people of different ages, so seniors and youth at the table, people of all incomes, including low-income communities. So those are the sorts of diversity in stakeholder groups that you also want to be thinking about. And they're not going to match up perfectly if you can envision, I couldn't get this to work on the slide, but that outer circle spinning and the different community groups might be represented, it's not going to match up perfectly. And so just really thinking strategically about having that diverse group, not only by the sector that they represent, but also by those the characteristics and the culture and what perspectives they bring to the table in addition to those sectors that they represent. So when we're thinking about equity, one thing that we found is that another kind of visual that you can think about is like what creates health. What is health to start, and then what creates health. And there's a phenomenal model or there's a phenomenal concept of like health is socially produced. So it's not necessarily produced by our genes and biology. As you can see, that's about 10%. But our physical environment, our ability for clinical care are also pretty small percentages. So those are the folks, when you ask large groups, what creates health, a lot of times they focus on genes, biology, physical environment, and clinical care. But as you can see here, a large part of what creates our health is social and economic factors as well as health behaviors, which is why that public health approach is really critical. And our focus on health being that more public health focus is really, as we've actually transformed the public health vision, thinking about these social and economic factors and health behaviors. The World Health Organization came up with a very robust, very interesting graphic that I have here on the slide. And as I said in a previous training when I brought this slide up, this slide is dynamic, it is complicated, and quite honestly, I could speak for 2 hours about all that's contained in this slide. And what's important to understand is that there is a complexity to figuring out social determinants of health and equities, health in general, and that we're all working to try and figure out how we can actually improve the health of a community by looking at all sorts of things that include governance, policies, and those public policies that we're really focused on related to public health, but also thinking about culture and societal values and how those all interrelate to the concept of health and social determinants of health. And so I have been assured by the Kansas Department of Health and Environment, Kansas Department of Health and Environment, that this is a slide that really warrants its own training. And so I just wanted to kind of tee it up and just please be aware that there will be more trainings available in Kansas related to this concept of social determinants of health. So one of the opportunities that we have is to think about equity from a kind of what can we do. I've sat in many trainings and have sat in trainings and also done trainings where people really struggled, and I've struggled to figure out, okay, what are concrete things that we can do to improve the health of our communities through this equity framework. And the equity framework that I just discussed from the WHO, so here. So if you think about having thinking about that socioeconomic positioning, health, education, and occupational health, how that can impact our work. So what can we do at the individual level, because it's such a big concept to conquer. So one of the things that we have really struggled with is, like, what are some concrete steps? And because policies themselves are spatially neutral. Race is silent, ethnicity is silent, even the rural-urban dichotomy is silent. And so you really have to dig deep to understand those negative and positive racial impacts, that urban-rural dichotomy, those impacts. Also, the negative impacts may or may not be intentional. So that's those unintended consequences that we face. A good example in Kansas is there was a really robust effort to improve the connectivity of the community, and the focus of the transportation department. They did a lot of work. They updated sidewalks, they updated streets, and then when the work was complete, what was really apparent was that it was part of the community that really felt the impact, and that the low-income part of the community and a community that had a higher, a community of Latinos was not impacted by those positive efforts to improve biking and walking opportunities. And so it was an unintended consequence of a policy that was really robust and meant to improve the connectivity of the community, and what it did is it created a really obvious differential between the community, the low-income community, and then the urban center, or I'm sorry, the center of the business district. So when those sorts of impacts are not considered during the decision-making process, there is a more likelihood that these negative impacts will be a result. So it is really important that we're thinking about those unintended consequences. And again, one example is, we have a great example in the city of Minneapolis. The Department of Regulatory Services started using these equity principles in all of their policies, and what they did was they realized that one of their policies, which was their towing policy, was having a disparate impact on low-income and communities of color. So what they realized is that their towing policy actually impacted those drivers in more dense and low-income areas because they did not have access to garages, so they were parking on the street, and they didn't have a space to actually park their cars when there was a snow emergency. And so there was they identified this problem, and then they actually identified some opportunities to address this problem. So having there was a grace period, for example. They worked in a grace period for towing when the storms were not in the forecast. There was also talk of having other spots where people could park their cars, so public lots available that were easily accessible to these communities to use, and communicating that information well to those communities. Another example that comes out of Minneapolis is there was a staple foods ordinance, which many of you might have heard about, where there was a requirement for small grocers and different retail facilities to stock staple foods, so bread, cereals, proteins, and fruits and vegetables. One of the council members actually met with a lot of the small grocers in minority communities and realized that there could be a potential impact, and the grocers could go out of business and because they didn't have access to a distributor who could provide those items at a cost that was going to be, they weren't going to be able to sell those products in their community. And so he actually worked to find a distributor that worked with those small grocers and connected them with some farmers locally who were able to actually bring in locally sourced fruits and vegetables to meet some of those standards. And so it was a proactive approach and a policy change that was really able to positively impact these grocers that actually served minority communities, which was really critical in those areas to prevent food deserts. Another great example of thinking about unintended consequence is when we're looking at a program called the Child and Adult Food Care Program. So this is a program that provides food for children, primarily children, but also adults in care, with primarily child care settings. And so it's a voluntary food program, and there's a reimbursement for breakfast, lunch, a snack, and a snack. And they have different food components that are available. And so this crediting handbook for the program actually has a series of recipes that are available, as well as a list of foods that do or do not qualify for that food, what's called food component. And what they found is that the meals and the different foods that were listed did not really fall into certain culture or ethnic food groups, as well as the traditional food that was used by different tribes across the country. And so the USDA actually receiving several questions from different tribes in different areas actually came out with a specific memo that outlined, okay, here's how the CACFP program actually applies to traditional foods of Native American communities and or different tribal traditional foods, or foods in Indian country, and that was then that community in particular was able to then use the CACFP program in a way that actually promoted traditional foods, and were able to identify what foods fell into this reimbursable meals. And we had a similar problem, or we are having a similar problem in Minnesota and in the Twin Cities, because we have a very large Somali and Hmong populations, and again, because the food that is laid out in the crediting handbook doesn't really reflect the traditional meals that are served in those communities, it's unclear whether or not there are traditional foods that would qualify for that reimbursement, and we have heard from several child care centers and several child care providers that they do not believe that this is a food program that would work for their food because of they wouldn't get reimbursement. And so that's another opportunity. There's an unintended consequence. There's a whole community that is not necessarily getting access to this food reimbursement program, and there's an opportunity to create a written guide to help translate how the crediting handbook could actually apply to the traditional foods of the Somali or the Hmong populations and their traditional foods. So just thinking about that from this choice points concept. So choice points is this idea that every single decision-making opportunity creates a choice point. So we are making a choice that can influence outcomes. So in that example that I just just provided from the CACFP program, there was a choice point that was made on what to include in the crediting handbook. That was a choice point. So there was a decision that was made to actually include a set of meals that, a whole set of meals on what would be credited for the CACFP program. That was a decision-making opportunity. And these choice points come up at every aspect of our professional careers, and there's a cumulative effect where small choices can actually provide a big impact. For example, if you're working on a survey in your community, the simple questions that you choose to ask the community actually create an impact on what survey results you have. What choices you have for the ethnicity, for the race on your survey, what age groups you have, what language you put the survey in. These are all really critical choice points that influence the final result. So there are small decisions along the way that influence big decisions or have big impacts. And so one of the things that we thought of that would actually provide a framework of, what can we do in campus, is if we think about it from this choice point perspective, what we're able to do is actually from a choice point to choice point, from decision-making opportunities across the board, we can provide some guidance on things to keep in mind so that we can make incremental steps to improve our environment, to improve equity concepts, to improve the public health of our communities across all communities, not just one particular community. And so that is really that kind of framework of choice points. And so we have a series of questions that we actually found on Race Forward, and these are, we rolled them out at a in-person training, and it is, we're going to present them on today's webinar, but I think there's a lot more experimentation that can go on as we're using these from a public health policy drafting perspective. So the idea is that as you're working on a policy, as you're working on putting an effort in writing, as you're working on coalition building, at every point you're asking these questions. What are the decision-making points that affect the outcome, okay? There are many that occur throughout our coalition building from the very initial position of who are we gonna invite to the table? What table are we gonna go to? And whose table should we maybe go to as a coalition or effort? So number two, what decisions and actions might be reinforcing the status quo, implicit bias, or current inequities? One of the things that we continue to find is that the same folks are around the table. An example would be there might be a situation where the same people are coming to a food systems meeting, and they've identified, that group has identified that there are other folks who need to be around the table that are not there, and they've been given an invitation and they're not coming to that table. So what decision or action is that reinforcing that status quo? Well, it might be that you are having a meeting at a time that isn't really going to work for that group that you want at the table. You might be having meetings during harvest, and so local farmers are unable to attend. You might have a situation where if you're trying to impact a particular group or sector, the working hours of that group or sector just don't fit with the timing of your meetings. It might be that your meetings are in English and that the group that you're trying to impact does not speak that language, or that's not their first language. And it might be that you have done the hard work of trying to create that relationship of trust. And so thinking about what decisions and actions are reinforcing that status quo. And then going on to that next question of, okay, we've identified that. Well, what are some alternative actions that have produced different outcomes? And I did mention an example. So we assume that people are going to come to our table, but there are opportunities to go to other people's tables and listen and learn and actually shift the dialogue into the framework that we're, from that status quo. And then the fourth is kind of what action is going to best advance that equity and inclusion. So how can we best include all of the people, all of the different stakeholder groups, but also all of the different community groups that we want to be attending our coalition, to be engaged in our coalition, and engaged in our policy efforts. And then finally, what reminders, supports, and accountabilities can be structured into our practices to make sure that equity gets high priority. And often what local governments have been doing to address this is actually having a checklist. Even asking the questions about equity, about bias, as policies are going through the drafting stages can be a critical first step to addressing these choice points and to really think about advancing equity and inclusion. So these are just 5 very easy questions that can be referenced as you're going through decision-making efforts, and having the group, but also individuals, really having that accountability to the process can be really critical to success. So when you're thinking about this institutionalization of equity, so really, embedding it beyond the personal, beyond the individual, because we've institutionalized inequity. We've spent decades. I mean, my field alone of law has institutionalized inequities across different cultural groups, racial groups. Again, going back to that urban-rural divide, one of the things that we talk about in this concept is the American with Disabilities Act. Before that passed, if you think about somebody who had an individual with a disability, for example, if they were utilizing a wheelchair, where they could go and not go really depended on the infrastructure available and the infrastructure of that public space. And with the American with Disabilities Act, it really brought in the vision that all public spaces should be accessible to people of all abilities. So just the change in the design standards for a ramp on either a building or on a sidewalk, having the bathroom have a space where a person in a wheelchair was able to go into, either get into the door, not only into the stall. These were critical policy changes where we had decades, if not centuries, of design standards that didn't actually promote that public usage by people who were in a wheelchair. So thinking about this, how long it has taken for us to transition. I mean, there are still buildings that don't have, that aren't fully accessible simply because they were built so long ago. And so thinking about how long that process is on really catching up and really kind of pulling out those institutionalized inequities that are built into our laws, our design systems, our policy, is really important to understand on how kind of long haul this is, on how we really need to be intentional about institutionalizing this equity. And so this list here really talks about how implicit bias versus explicit bias. So it's thinking about, implicit bias is really things that we're in control of. Implicit meaning, the individual, whereas explicit are more of the institutionalized mechanisms that are promoting our public health disparities and other inequities across laws and policies. So an individual might be unaware of choice points. They might not be thinking about how their choices impact the overall outcome of what they're working on. Whereas explicit bias is actually thinking about, building, and a way to overcome that implicit bias is building in decision-making guides that actually consider equity, actually consider choice points. thinking about the exclusivity of those stakeholders, so thinking about who's already at the table and how that's an exclusive club that might just be focused on kind of the traditional players, quote unquote, which often is really is indicative of that white privilege that we can talk about on having, the same people at the table who represent people who are white, who have the privilege of being of a particular race, or maybe it's having people from an urban setting in a rural context, having them make decisions about the rural folks who they have no context of what it is like to grow up or live in a community of 100 people and are trying to apply that urban setting to that very rural setting from that top down. So really thinking about the exclusive stakeholders, that's that implicit bias. Whereas if you actually move to this kind of really a more institutionalized way of addressing equity, you foster active engagement and empower that diverse group of stakeholders. So you really look to the community you're trying to impact and pull them in to the decision-making process. So if you're looking on a policy that's going to impact rural communities, you actually have rural folks sitting at the table. And it's a diverse group from that rural community. It's not just one voice. So the other, some other concepts here, not being attentive to race, gender, income, and other inequities in your community, whereas you can actually kind of institutionalize and give distinct, specific, and sufficient attention to those disparities and inequities that are specific to your community, because each community is very different. And so really framing it within what is happening in your local context. Looking at barriers to access, so there are language barriers, there are educational barriers. I, again, represent a field of law that is really trying to transcend the barriers that's created. If any of you have read some of the gobbledygook that is in our laws, at the state level and at the federal level, you'll understand, I feel like it's job security for lawyers. But thinking about what can we do to implement strategies to remove the barriers, and I'm going to talk about a few of them today, where good policy drafters are really thinking about not creating language that actually creates a barrier to understanding and guiding people, whereas if you just have a very, very simple way of talking about something and not using all that legalese, it could actually remove those barriers for more people. And then finally, that implicit bias is not considering racial or other disparate impacts. So not thinking about how a particular community is going to be impacted by a towing policy, or how a particular community is going to be impacted by a built environment change, for example, by updating the connectivity of trails or sidewalks. Whereas you can actually move that to that explicit bias and really facing it head on by systematically analyzing and asking the question, like, how is this going to impact the community members? How is this going to impact disadvantaged groups? A great example of that is recently the federal SNAP rule, so the formerly known as food stamps rule. They were talking about changing to promote public health, promote healthy food. They were looking at changing the stocking requirements to ensure more of that kind of staple foods was available in any participating grocery store or retail outlets that actually accepted SNAP. Well, folks in grocery stores in Indian country and in rural communities were very vocal about how that could potentially impact their ability to be a SNAP participant, to a provider, and accept SNAP benefits, because they may not be able to have all of those food stocks, because what we were hearing is that their distributors, the people providing them with the food, would not necessarily provide them for those food items at a price that was affordable. And so that's something to think about, and then frame the policy around how is, and then if you think about that, it trickles down. So if you have less SNAP participants in rural communities and in Indian country, you're going to have this really bad outcome for those groups in Indian country and in rural communities that already are food insecure. And so thinking about all those things can be really hard, but is a critical part of institutionalizing equity. And you can apply those choice points to policies all across the board. But quite honestly, most of you who I've talked to in Kansas are working in that orange and yellow area, so the local, and then working on internal policy and rules. You know, that's really where we have a great opportunity to impact and change and really experiment to promote health and equity in our local communities, either through those kind of internal policy or local government. And I just want to say, you know, this work is really hard. I can sit here and talk to you about choice points and really talk about how these are really important concepts to keep in mind, and equity is really critical. And I just want to be transparent that, you know, the Public Health Law Center does not have all the answers. We are also experimenting. We're experimenting with how we communicate this information. We're experimenting with how we incorporate this information into our tools. A great example is here. Drafting Effective Policies is a tool that we created for Kansans. It's actually framed how do you draft an effective policy, and it uses leadership competencies, and we match those with the different, you know, parts of the drafting effective policies. And what we realized as we were preparing for our training last week is that, you know, we were also not ensuring that those choice points were incorporated into the information we are providing to you to think about and to consider while developing a policy. And so we've, you'll see in this document that's on your right-hand side of the screen, we've actually updated the Drafting Effective Policies checklist that's contained in our resource, and we are currently updating our resource. But in the meantime, we wanted to provide you with the right-hand side checklist, which the gray area are some choice points language that we've incorporated based on our own research and experimentation. And so I think what's important to understand is there's an evolution of this work, and you know, we didn't get to the place where there are such great health disparities in the course of a year or 5 years or the course of our grants that we're working on. And so this is a long haul, and it's an approach that we really need to do together as a community, and the Public Health Law Center is here to support those efforts. And so, you know, we're in here, you know, in doing this together, and we would welcome your the information that I just provided. You know, we welcome your thoughts and suggestions and ways to incorporate these concepts into the resources that we provided to you. But there are some kind of basic understandings for drafting effective policy, and I'm going to go over these. They are included, as I said, in this Drafting Effective Policies resource. And drafting effective policy is something that gives us all a lot of pause. It's very technical work in some ways because it feels very technical, right? So you sit down, you draft it, and then you're done, and you don't have to do a lot of that really hard adaptive work where you're pulling in a lot of different stakeholders or coalitions, and that's the way people draft policies. They do it in a vacuum, and I'm here to say that that is not a good way to draft policies. It is not technical work. It is adaptive work, and we're going to go over some of the highlights to use from a technical perspective, but thinking about that adaptive component, like asking people, pulling in coalitions, asking hard questions, really challenging existing, you know, assumptions. You know, these are all really important things to do as part of the policy drafting journey. So this is kind of 4 guiding principles that we use. An effective policy is something that's easy to follow and understand. Again, we have lots of examples. At state law, and even at the local level, policies are really convoluted. So this is just a guiding principle. Another really key concept, it's easy to enforce. You actually know how to enforce it. You know how to implement it. That it accomplishes the goals that it sets out to do. And then finally, that you have a process for periodic evaluation. We are not a static society, nor should our policies be static. And so it's working in concepts of like periodically and evaluating policies is really critical to successful and effective policies. So we've identified some do's and don'ts. So these are kind of the highlights. Be clear and concise, be consistent, be specific, and be practical. So, you know, the clear and concise, again, I'm an attorney, so I represent, I feel like, a group of folks who don't know how to do this well. But there are some touchstones that are really important. Some of the ways that people can fall prey to not being clear and concise is by, the definition. So we've all seen really complicated, long lists of definitions and policies. And, we do not, unless something needs to be defined, so there's a general kind of misconception on what something might be. For example, what a healthy beverage is, that needs a definition. Healthy beverage needs a definition. Healthy often needs a definition. But we don't necessarily need to have definitions for every single word in a policy, and that could actually run afoul of this being clear and concise. So using definitions appropriately is really important. Eliminating unnecessary words is really critical. What I always recommend when folks are writing a policy is actually writing it down, the policy, working on it, and then going through it again and identifying all the words that are superfluous. Those words that do not necessarily need to be in there, they don't add anything. They just create more words on the page. And then the other opportunity is keeping language simple. I have seen it time and time again with lawyers and non-lawyers alike using really big words for something that doesn't necessarily need a big word. And there's several examples in the tobacco control world where you have the actual plant definition for the word tobacco used rather than just having to define a definition and a word for tobacco and what that means. Another example would be using really big words related to complete streets or from a planning perspective. As we work with other sectors like planners, making sure that words mean the same thing and keeping that language simple from the perspective of being able to think about it from a community perspective. Like, okay, how are we going to implement this? If we keep that language simple, the community is going to be able to follow this law, follow this policy. And then finally, being really precise. Not running around, writing a whole paragraph when all you need to say is the effective date of this policy is on April 1st, 2017. That does not need any more than that language. Being precise is really important when talking about effective dates. Being precise is really critical when you're talking about the implementation and enforcement. Being precise in those things can mean the difference between having a piece of paper that sits on a shelf and collects dust to actually having something that's an implementable policy that people can follow. Being consistent is another really critical concept. So being true to your policy objectives and not getting bogged down by a lot of other information. Really using the policy language and being consistent in the language. So if you're using the word healthy beverage, don't use any other concept after healthy beverage is defined. Just use the word healthy beverage throughout the rest of the document. If you use the word local and define what local means to that policy, be consistent and just use the word local. And so having that policy language be consistent throughout is really critical. Here's where we also see a lot of confusion. It needs to be internally and externally consistent. We see this a lot in school boards or school district policies where, and it actually happened a lot when the school wellness policies were created. School wellness policies create a lot of language related to promoting active play, biking and walking, and then also promoting healthy food. And so that was consistent within the school wellness policies, but what it didn't do was it was not consistent with other policies that the school district had related to food procurement, related to advertising on school buses, related to a transportation policy. And so there was inconsistencies within these other school district policies. So you need to be consistent not only within the four corners of the policy that you're writing, but understanding what other policies impact the policy you're writing. and the Public Health Law Center is available to help many Kansas communities navigate that. All right, so the other really important thing to think about is being specific. We find this a lot, and I'm going to go into some of the ways you can run afoul of this in my next section, but being specific on what you're trying to impact. If you're looking at a large urban area and your policy is trying to impact the sidewalks in that urban area, so on that left-hand side, then be specific for that policy related to that setting. That is going to look really different than a more rural setting and the sidewalks that you're trying to impact in that rural setting. And so really being specific of what you're trying to impact, what you're trying to accomplish, and the specific design standards, for example, for sidewalks that you're trying to implement in your community. So being that very specific is really critical. And then being practical and reasonable is really important. So thinking about cost. I mean, boy, the policies that we could all write if we didn't have to think about cost, it's really, you know, I think we can all, with that, I feel like those are the magic wand policies where in a perfect world, we'd all create these wonderful policies, but you have to think about what's practical and implementable. So one of the things from a cost perspective when it comes like tobacco control policies, thinking about signage, how much is that going to cost? If you're implementing a tobacco control policy, what are the effective dates, for example, that you need in order to have the approach to make the policy be successful? And this also happens with like that staple foods ordinance that I explained, you know, what sort of cost implications and effective dates were needed in order for those small grocers to be successful. And are people have an ability to follow the policy? And if not, again, as in that Minneapolis staple foods example that I provided, you know, if they don't have the ability to follow the policy, what do they need in order to get up to speed, in order to get there so they can follow the policy? And many of these first three bullets are actually those unintended consequences that come up. Thinking about those costs can actually, if you think about cost, effective dates, and ability to follow policy, you can head off many of those unintended consequences that can actually increase disparities rather than decrease disparities, as we're trying to do with our public health strategies. All right, so as we get to what, you know, those don'ts, really the list is kind of the flip side of what I've already talked about. So you don't forget to do your homework, don't draft by Xerox, don't draft in isolation, and don't misuse exemptions. So your homework, I mean, you need to actually involve a diverse group of stakeholders. We talked about this already, thinking about not only a diverse group of stakeholders from the perspective of the stakeholder or the factions that they represent, but also the lived experience that they represent, their age, their gender, their cultural or ethnic or racial groups, their faith, their sexual orientation. You know, these are all really critical concepts to have in mind when you're pulling in a diverse group of stakeholders. There are sample policies that are available for you to review, and we'll talk about kind of the pros and cons of sample policies. Don't forget to involve legal assistance. So the Public Health Law Center, again, we're really embedded into the Kansas work, working at the local level. I always say, you know, if you have a question, even if we don't necessarily have a funding stream that can support a lot of in-depth work with you all in Kansas, we've worked with so many communities, we may already have the answer from some of our previous work. If you don't see the answer in our resources, you know, we've done a lot of one-on-one work with communities. And so please, just if you have a question, just ask. And so we may be able to provide you with the answer, at least get you to the right person. The other big thing that happens is identifying deal breakers. Many of you who work in tobacco control understand this concept, where the idea is like where is a policy no longer a good idea? So what is that deal breaker moment? This happens a lot with healthy food procurement or healthy food in public places. You know, what nutrition standards are you willing to waiver on, and then where does it hit that point where you're no longer, as a coalition or as a group, you can no longer stand behind that written policy and you actually have to go back to the drawing board. And then also anticipating challenges and unintended consequences is really critical. And that could come in a variety of ways, whether that be from, you know, thinking about from that choice points perspective, you know, asking those questions along the way. It could also be unintended political consequences, or, you know, it could just be a bureaucratic. People often forget that, you know, we're working within these local governments who are strained and don't have a lot of time, or they may be working within a system, like an electronic system that doesn't allow for certain things. And so thinking strategically and anticipating those bureaucratic challenges can be really critical. And then also anticipating the legal challenges. So thinking about, okay, does this run afoul of like what's going on legally? Can we even do this? Do we have the authority as a local to, you know, push our local government to do a particular strategy, or are they not able to do that policy because of some legal challenge? So another thing is drafting by Xerox. So just because somebody's done it before, don't just copy that effort. And we see this a lot, especially with smaller communities with a limited amount of resources. My favorite example is we had a school district in Minnesota that we were working with that had a series of policies that they forgot to take out the insert school district name here language from their template policy, and they passed their school district policies and put it on their website with that language actually in their policy. And we've seen that happen where folks don't really use samples or other community examples and actually frame it to their local context. And so that's really critical. You've got to do that. You also need to not draft, so the flip side is don't draft in isolation. You know, use samples, use other community examples. Don't just, you know, sit down with a blank piece of paper and just start writing things out. And when you're thinking about that drafting in isolation, it's knowing that you're not alone. You've got stakeholders you can rely on. You've got folks like the Public Health Law Center to rely on. You've got other grantees across campus who I will tell you are working on the same thing you're working on. And so understanding that you just need to find those folks and learn from them and, you know, kind of continue on your journey with them together. And then also, the other thing to think about is your policy is not an island. You're not standing out there waving your hand. I mean, your policy has an impact, especially if there aren't a lot of other communities that have passed policies in the area that you're passing. So if you pass the first policy for example, tobacco 21 to ensure that the tobacco purchasing age is 21 years old, you know, and you're the very first local government that does that, your policy is going to be used as an example. And so if you write a policy that's not very effective or it's hard to enforce or it's not a very good policy, that could have negative implications for everyone else across the state. And so you really want to look at those local, state, and national trends. And also thinking about how your policy can either institutionalize equity, since what we talked about, or can actually have a negative impact on equity. So thinking about how did your policy fit beyond just the four corners of the page. So the other thing that's happened a lot is people use exemptions. So you want to make sure your policy doesn't overuse those. It makes it really hard to enforce, and it could actually leave it open to legal challenge. So if there's a lot of special interests that actually opt out what the policy might apply to. So if you have a lot of exemptions on what a healthy beverage might cover, they could actually make the overall implementation or like being effective really limited. So because it weakens your objective, it makes figuring out how to interpret or enforce is really difficult. Thinking about, hey, if there's these 5 people who this policy doesn't apply to, you know, who qualifies as that 5, that group of 5? You know, people will fight to get into the exemption category oftentimes. And so you just want to be really, really careful. And it could inspire challenges as well. You know, I do a lot of work in the child care setting, and at the state level, many child care settings have a lot of exemptions on who actually has to be licensed, which means that they have standards that apply to them. And, you know, it really creates, it inspires challenges of people who are trying to get into that group of licensed providers who don't have to actually have a license. So you want to think about that. And you want to also think about how that could actually promote inequity. So if you have big interest groups who are saying, you know, we don't want this policy to apply to us, you know, does that promote that inequity because other people are actually impacted in a negative way? All right, so here's just a review slide of your do's and don'ts of what I just went over. And I will say this is also in that Drafting Effective Policies resource that I provided, and it is on our website. So thinking about creating your vision through policy change is, you know, really important. And, you know, we've given you some tools as part of today's session to, you know, think, okay, here's the vision that we want for our community, here's how policy can impact that vision, here are the do's and don'ts, here's how I apply choice points. And so it's a lot of different steps. And thinking about, you know, how much work it does to take to tend a garden, for example. You know, creating your vision isn't just planting the seed. Everyone knows that. It's thinking about, okay, what else you have in your garden, thinking about what soil to use, how much water to provide, you know, really fostering and caring for and coming back to what is in that garden. That's how you should treat your vision. It's not just a one-off event. It's a part of a process. So thinking in mind, what aspect of the system can you impact? These are all questions. If you're at the beginning of your journey to try and figure out how to impact change, how to implement a strategy in your community, think about what you can impact. For example, if you're working on a farm and food local task force, trying to change the farm bill, probably not your best first bet. You know, that is something that's at the federal level, it's not the local level. So thinking, you know, strategically, what can I actually impact as part of my effort? So then thinking about the policy and strategies you want to pursue is really important. And I'm going to show you some different resources that we've done for healthy food and active play and active transportation. We actually found that this could be really hard for folks who aren't policy wonks. And so we've come up with some strategies under healthy food access and under active transportation that local governments can pursue. Thinking about the obstacles is really hard. Involving a diverse group of stakeholders to actually think through those obstacles, really important. And we've identified some ways to do that. Thinking about those choice points is really critical as part of identifying those obstacles. And then finally, what tools are available to help. And with that, I just want to go back to those tools. The Public Health Law Center has really been strategic on what resources we've created, and we've done this, again, as part of this evolution of our work in Kansas. And we've involved community groups as part of the development of these resources, had them review the resources. We've been updating the resources as they've worked and not worked, and we have them all on our webpage. And so this is just a screenshot of the webpage, and it has the different, we've really tried to avoid a lot of guessing on your part on where our resources are stored. And so we've separated them into, you know, drafting effective policies, which is the topic of today's webinar. So this webinar will go in that first area, as well as some other places on our website. Healthy food resources, we have a whole page for that. Farm and food local task force resources specific to Kansas. We have farmers market resources, biking and walking resources, child care, rules and regulations, local government. And then finally, at the very bottom, if you are really interested to kind of go back to, okay, what sort of work the Public Health Law Center does and how we can help our kind of what is local legal technical assistance is at the bottom there. So our healthy food resources is really one of the most robust group set of resources. There's so much momentum in Kansas. I love going to national conferences and bragging about Kansas. I mean, as a fellow flyover state, with a lot of folks talking about California and New York, I really love being able to highlight the energy and momentum that you all have created in Kansas, and I think our work in the healthy food area really represents that momentum. So we have several resources. So our Kansas Government Controls Local Food Policies, which is a preemption bill that just passed, and I'll get to that in a minute. We also have a food donation liability in Kansas resource. This drew directly from questions you all had as you are working on food donation, and so restaurants donating to the food shelf, grocery stores donating to the food bank. You know, those sorts of questions that came up were the restaurants and the grocery stores were concerned about liability, food safety concerns. And so we developed a resource that's very specific. It talks about liability and the legal protections for people who donate food. And this cuts all the way across, like the big entity, like in Minnesota we have General Mills, all the way down to a small local restaurant that might decide, oh, I had a catering and we have some food excess that we didn't use in the catering event, you know, how can I donate that food and am I protected from liability down the road? And so we have a resource that lays out that information. We have a resource on healthy vending and the Randolph-Shepard Act, which is a new resource. That resource actually lays out a federal and state law that actually gives preference to vending contracts on state property to blind vendors, so visually impaired vendors. And this resource really walks through the opportunities that, you know, for healthy vending in those areas, and it really provides some context for folks on that, on the state and federal law that impacts the vending environment on state property. So we also have a new resource on federal calorie labeling requirements. So many of you know there was a federal law that passed that has specific requirements for menu labeling as it relates to food. And so we have a Kansas-specific resource. So it frames the federal calorie labeling regulations within the context of, specific context of Kansas. And this is really important because actually, as I mentioned, that Kansas government controls local food policies, that preemption law that just passed, that actually impacts menu labeling. And so we made sure to have a resource specific to Kansas for you all to use. And then we also have other resources that I'm not going to go into further detail other than this phenomenal resource, and I call it phenomenal because we tried to lay out, and this was a joint effort of the Healthy Communities Initiative group. We realized early on, folks, again, had problems figuring out, okay, what policies can I impact at the local level that can improve or can increase access to healthy food? Like, what can I do? And so we actually identified a series of local policies that folks can work on. And we gave examples, and this resource was created in January of 2015, and so we're updating that document, but this is a great go-to resource, and it's on our webpage under our Healthy Food Resources page. I've mentioned this a couple of times, the Kansas Government Controls Local Food Policies Law. I could spend another 30 minutes just in scratching the surface of this law, which many of you have been following, some of you might not have been following. It impacts the work that local level governments can do related to food policies and food-based health disparities. And so knowing that this is complicated and a vague law that is has concerned many local efforts, we created with a big group of partners at the state and local level, created a resource, and we have a webinar on September 12th from 10:30 to 11:30, and the link is on the slide. It's also on our website. This is going to be a definite go-to webinar to try and navigate local food policies in Kansas. And it's really important. In the meantime, if you have any questions or if you have experienced any sort of barriers in improving the food environment at the local level because of this law, I would really encourage you to reach out to me, and we're really trying to pay attention to what's going on at the local level. So just definitely reach out via email if you're having any issues at the local level, and then attend the webinar. So again, this is just kind of a sample of all the different information specific to promoting healthy food in public places. Many of you are working on contracts or RFPs or institutional organizational policies to promote healthy food, and so these resources are really for you to help guide you. And again, the Public Health Law Center, I really would encourage you to reach out if you have questions. And we'll see if we can either identify a resource that we currently have or connect you with another community who's been doing the work, or identify a resource that we've done that we may not necessarily have on our website. We also have several resources on that Healthy Food Resources page that I haven't gone over. So, for example, our Increasing Farm Institution in Kansas. And so it's just something to keep in mind. If you're working on healthy food access, please visit the site, and we have a series of resources, not just for kind of the graphics, like the one on the right-hand side here for farm to child care, but also we have a very specific policy brief on that farm to institution, and you'll see this link to the webinar. This is a great example of one of the things we found is that, wow, we have a lot of resources, there's a lot of words on the page, people are busy, and so what we're trying to do is roll out our new resources with webinars, so that you don't have to deconstruct all the words on the page, or you don't have to really dive deep if you don't have time. You can listen to a webinar where we lay out the information on those resources. And so we did this for the Farm Institution in Kansas resource. All right, so another page that we have is the Farm and Local Food Task Force resources. So this is a specific page dedicated specifically to Kansas efforts to create local food councils, otherwise known as Farm and Food Local Task Forces. People call them a lot of different things. And so we've identified just a one-pager, that one in the middle, as well as language actually for a resolution. If you're pursuing like a government-appointed food council, we have like a resolution drafting document, which is on the left, and then on the right we have a summary of your bylaws. So we actually identify kind of key components of bylaws which help to fit your structure, and identify also some language, sample language for you to start with. And I'll just say, as you may have heard me say, don't just use sample policies and draft by Xerox. The nice thing about the samples that we have that are specific to Kansas is they are specific to Kansas. They're not national samples. They're really unique and try and take in that context of Kansas. And it can't take in the whole context of every local community, but we've tried really hard to frame it within that Kansas context. And that not necessarily an urban lens through Kansas context, since those are kind of far and few between, but also like looking at that rural context. And so it's been really important to us to actually frame it from that perspective. And this goes for our farmers market set of resources. So we're currently updating these resources and plan to have those new resources rolled out in the new year, so in 2017. But we created a guide to operating a farmers market in Kansas, state laws impacting farmers markets in Kansas, local government regulation of farmers markets. So thinking about from that lens of, okay, what sort of local government regulation can both promote and hinder a farmers market? Like one great example in the more urban settings is parking restrictions. And there are also some rural ordinances on the books about where and when you can vend and sell more than, just food off of your own land. And so there are local regulations that can impact farmers markets, and so we kind of lay those out. We also actually identify just a sampling of farmers market vendor and market rules. These are really critical things that folks can think about from, like, we create sample. There's also some other great examples just from the vast focus on farmers markets in Kansas, and so we try and frame it within, again, these are resources we created over, I think it's now almost coming up on 2 years ago, so much has happened in the last 2 years in Kansas, but it's a starting place for you all. And then thinking about the organizational structure. Many folks have had questions about, you know, do we do a nonprofit, how do we formalize the farmers market structure, and so this resource really considers those nuances, puts it and frames it within the law, but also thinks about it from kind of a perspective of the different options available to an entity like a farmers market. So switching gears a bit, we have a series of resources to promote biking and walking in Kansas. And our newest resource is literally hottest presses, and it's focused on sidewalks in Kansas. Who's in charge of what, and what are the liability implications? We kept getting this question over and over again, and we've already had new questions come up related to sidewalks. It seems to be a really, you know, there's a lot of heat around this issue in Kansas right now, promoting sidewalks and ensuring that sidewalks are available and are connected and are in good repair to actually be a critical resource to promote biking and walking. And so that's a resource we have available, and we will likely be rolling that out with a webinar in the future, so stay tuned for that. But we also have things like how to use shared use paths and trails, how to differentiate between different concepts of like active transportation and rec facilities. So, you know, these have all come from specific questions from communities. And so it's not unusual for a community to ask this question related to biking and walking, and then for that to translate into a very detailed memo specific to their local context, and then, you know, 6 months down the road with input from a series of communities for us to then actually put it on our website as a resource. So that's kind of the evolution of how our resources are created. And again, that sidewalks in Kansas is a great example. And just like our healthy food environment, we really that our biking and walking, or bicycling and walking resources at the local level, like figuring out what do we impact, how can we affect change at the local government. Folks are struggling, and so we kind of laid out some different opportunities for local governments to work on to promote bicycling and walking. And so this resource is available. Again, we created it in January of 2015, and there's been some phenomenal energy and momentum, and so we will likely be updating this resource in the next year to really reflect that momentum and energy. And I'll go over some of the specific resources that we're working on, but I will just say, you know, using planning and other land use planning opportunities has really been a great resource for folks in Kansas related to promotion of bicycling and walking. So I'm not going to go into too much detail since many folks are not working on this at the local level, but we also have resources specific to childcare and rules and regulations at the state level, and have pages specific to those concepts. And again, this is specific to Kansas. And then under our local government resources, actually a page that several of our resources are in the development pipeline. But one of them is land banks. And the land banks, for those of you who don't know, are kind of the process for when a dilapidated or a property in disrepair is bought by a local government. They create a land bank. It's a legal structure, and the land bank itself buys the property, clears the taxes, and either sells the property to a developer without that tax burden to benefit the land bank, which is, you know, a city or a county entity, or it's actually then used by the local government for the community benefit. And many communities are exploring the land bank. The land bank is a policy strategy to promote community gardens, because they're trying to take unused property or underutilized property that has a high tax burden, so it's not a good opportunity for sale. And really turn it back into a community benefit, such as a community garden or another kind of space for a small or mid-sized grower to use to, then support the local economy with locally sourced food. So I went through a lot of the resources the Public Health Law Center that is specific to Kansas, but I would be remiss if I didn't just say we work across the country. Kansas certainly is, I work a lot in Kansas, but I also do national level work, as do my colleagues, and we're a team. Mary and I do the majority of the work in Kansas, but we build off the knowledge of some of our other colleagues, from the Kansas lens. For example, many of you have met Jolie Ralston-Aoki, who will be working on the Kansas government control law of food policies, and she's going to be doing the webinar because she's an expert in preemption. And so we really, our work across the country, we're constantly maximizing that information flow and sharing and learning, and try to frame the national context into the Kansas experience and vice versa. So not only am I at national conferences constantly talking about the amazing momentum in Kansas, I'm also learning at those national conferences and translating that information back and trying to, share and learn and provide context that will then build the capacity in the Kansas communities on areas like Safe Routes to School, for example. And then just for those of you working in the tobacco control arena, we are the program of the Public Health Law Center, the Tobacco Control Legal Consortium. They work across the country on policy change and the tobacco control movement. They have their own part of our webpage. They haven't done Kansas-specific resources, but quite honestly, they have covered so many different topics. And have, our resource for technical assistance for communities across the country, including Kansas. So, for example, they have all this information on tobacco retail licensing, local authority, they frame it within the local context, they have model policies, they review local policies, they do a lot of work related to retail licensing. I mentioned Tobacco 21, which is a big push in many states. Including Minnesota, and so they, the folks in the tobacco control team, they actually have worked with several communities across the country. They have sample minimum legal sales age ordinances. They actually can help you frame this as a public health, to the public health lens as well as other lenses. And the other thing that they do, which is really great, is help translate it from a science research perspective. They've done a lot of work on tobacco-free campuses and smoke-free housing policies. They've been able to provide comments, for example, on folks' policies, like a tobacco-free campus policy that's being drafted. They give a line-by-line review based on their expertise, really following that individualized legal technical assistance lens. They can actually identify areas where you might be missing, so best practices for enforcement, signage, timing, community outreach, that sort of thing, just because they've worked on so many across the country and have partners who have even, done that work as well. And then e-cigarettes is another area that various states are working on, so incorporating the language, figuring out how local and state smoke-free air policies impact or can really incorporate e-cigarettes and the language, and then how to use definitions in this realm, which has been, there's a lot of lessons learned, and so they are a phenomenal resource, both through their webinars, so their resources, and then through individual technical assistance. All right, so with that, I just want to talk about what's next, because I've gone over a lot of resources, I've given you a lot of information, but I also we're constantly moving this work forward, and I think there's some really important resources coming down the pike, and I want to make sure you know about them in case you're working in the area and you want to get a preview before we put it on our website. For those of you who don't know, getting something from the drafted to final phase can be, it's not a quick turnaround time necessarily. We have a person who does the formatting and everything, and so we have the content in final phase and ready for community use maybe before it gets on our website, not maybe, before it can get on our website. And so we don't want to have any time delay in when communities need the information. So don't wait for these resources to come out. If you have a question about any of these concepts that I'm going to talk about, please email me. All right, so we have a resource that's specifically coming out related to comprehensive planning and food systems. So comprehensive planning means a lot of different things. Sometimes it's called master plan, sometimes it's called comp plan. And so this research really talks about that planning tool that local governments may use in Kansas and how traditionally it's been used and how to use that traditional framework to embed food systems into the conversation. I will say that planners at the local level are thinking more and more about biking and walking, and they have had great movement and momentum in their own field, in the field of planning, to really do that. And food systems, I think, is kind of that next area. And so we have a draft of that comprehensive planning and food systems resource, again, specific to Kansas. We will hope to have that completed in the next couple of weeks. If you are interested in reviewing that resource, or if you have any information that you need right away, please let me know. We're also doing some work on shared use and intergovernmental agreements, and what I mean by this is actually, turns out, in Kansas, it just means community use of school property in Kansas, and there are laws related to intergovernmental agreements, so that's two governments trying to share a space. But there's also information specific to liability concerns that schools may feel is going to be a barrier for opening up the school property for just general community use. And so our resource will lay out this intergovernmental agreement structure, as well as identifying the liability protections that currently exist for schools and school districts in Kansas related to community use of school property. And that should be the completion date currently is the end of September. So we're also, and those two items actually are being funded by a grant from the Kansas Department of KDHE. Season extension laws, which means the ability for people to grow crops beyond just based on weather. So hoop houses and root cellars, and the different laws, both local and state, that impact creating hoop houses, cellars, such as a building code or a local ordinance that might limit structures on a particular property. And so we're doing some resources with Casey Healthy Kids to really think strategically about policies that could impact the ability for small and mid-sized growers to extend the season beyond the current growing season. We also have a resource that's nearing completion on open meetings laws. KHS actually, what we identified under that grant was that food councils in particular, so locally created or locally appointed food councils, were needing a resource to really kind of deconstruct and understand how open meeting laws applied to them and what those requirements were. And so we've created a resource related to open meeting laws that should be ready to post on our website in the next month or so. We also have a resource coming related to that CATFT program, so the Child and Adult Food Care Program and Summer Feeding Programs. And finally, and this is something that many of you may want now, I've been actually sending it out pre-release a lot. We've taken all of the different resolutions, food council resolutions, and all of the bylaws that we have across the state, and actually put them in and grouped the information and put the language in a table so that folks can see where communities are using the same language, where they've used different language. It's actually like using a sample document, except for that the samples, there's a lot more samples to pull from. And the reason why I find this resource is going to be really helpful now that we have this critical mass of resources is because what works for one community might not work for another. And also, there's also been some pushback by folks when they don't understand that other communities of their size and maybe that look like them, well, what have they done? And so this resource actually allows for like a resource that allows for you to find that information very quickly to answer those questions by your local policymakers. And as I said, you know, it's hard to actually just go through written documents, and so we have a series of webinars. We have a Complete Streets webinar on September 1st. That Complete Streets webinar, and we may be postponing that, but for now will be listed, the link will be listed on our website. That Kansas Government Controls Local Policies Law is set for September 12th. I already talked about that. The shared use, community use, and liability is September 22nd. And then finally, we'll roll out that comprehensive planning resource on September 28th. And so those are a series of resources that we currently have available, but I would encourage, we are constantly adding resources and webinars and have other really important information to communicate for Kansas communities. And so our webpage, we are working to make that webpage a much more interactive space. So we'll post our upcoming webinars so that folks can actually just go there and get that link. And so we're working to do that in the next few weeks. But in the meantime, my email is here. Please use my email and reach out if you have questions or concerns or something that I didn't go over during today's presentation.